Hello, my name is Salina Pleshka, and today our group is presenting about dementia. We will discuss what dementia is, how it affects individuals, and why understanding this condition is so important in health and social care. Dementia is a condition that affects millions of people around the world. Many people believe that dementia is simply a normal part of aging, but this is not correct. Dementia is more common in older adults. However, it is caused by damaged brain cells which affect how the brain functions. Dementia does not only affect the individual who has the diagnosis, it also has strong emotional and practical impact on families, friends, and carers. Watching someone slowly change can be very difficult, especially when communications, memory, and behavior begin to change. As a future health and social care professionals, it is important for us to understand dementia so we can provide safe, compassionate, and person-centered care. Every person living with dementia has their own personality, life history, preferences, and needs, which is why care should always focus on the individual, not just on the condition. So, what exactly is dementia? Dementia is not a single disease. It is an umbrella term used to describe a group of symptoms that affect cognitive functions, such as memory, thinking, problem solving, communication, and behavior. One of the most common symptoms is memory loss, particularly difficulty to remember recent events. For example, a person may forget what they did early in the day, but clearly remember events from many years ago. However, dementia is much more than memory problems. A person may become confused about time or place. They might struggle to find the right words during a conversation. Some individuals experience changes in mood, personality, and or behavior. They may become more anxious, frustrated, or withdrawn. Dementia is usually a progressive condition, which means what symptoms gradually become worse over time. In early stages, a person may still live independently with only minor difficulties. As the condition progresses, they may require more support with daily activities such as cooking, dressing, managing medications, or personal care. It is very important to remember what dementia affects the brain, but the person is still the same individual. They still have feelings, emotions, memories, and they need for dignity and respect. By understanding dementia, we can provide better support and create a safe and supportive environment for people living with this condition. I will now pass over to my colleague who will explain the different types of dementia. Thank you.
Hello everyone, my name is Olubukola Badipe. I'm here to talk about types and causes of dementia. Dementia is not a single disease, it is a syndrome caused by different underlying brain disorder. And according to WHO, dementia is defined as a syndrome like a group of related systems associated with an aging decline of brain functioning. Types of uh, types of dementia we have Alzheimer's disease, vascular dementia, frontotemporal dementia, and mixed dementia. We have Lewy body dementia. Above all, Alzheimer's disease is the most common dementia, after which is vascular dementia. Alzheimer's disease, most common between 60 to 70 cases, caused by abnormal protein buildup in the brain. Vascular dementia. Vascular dementia is the second after Alzheimer's dementia, caused by reduced blood flow from the brain. Also, we have frontotemporal dementia. It is characterized by the body protein deposit, commonly from the age of 65. We have mixed dementia. Mixed dementia is the combination of both Alzheimer's disease and vascular dementia. We also have Lewy body dementia. It is caused by abnormal protein deposits called Lewy bodies. Risk factors of dementia. We have non-modifiable and modifiable risk factors. Modifiable is something that cannot be changed, like age, family history, genetics, and Down syndrome. We have modifiable, like something that can be reduced. These are important because many cases may be preventable, like lifestyle and mental health. We have cardiovascular factors like high blood pressure, high cholesterol, obesity, smoking, like stroke history too. Yeah, those are the risk factors. Excessive alcohol, poor diet, depression, etc. Other factors include traumatic brain injury, hearing loss, and also sleep disorder. Those are the risk factors. In conclusion, dementia is a progressive cognitive decline affecting daily functioning, and the most common, as I said earlier, is Alzheimer's disease, followed by vascular dementia. The risk factors, modifiable and non-modifiable risk factors. Early recognition and risk reduction are essential to delay progression, and also the way, as in lifestyle, the way we live our life too, are part of the risk factors of dementia. Thank you.
Hello everyone, I am Renuka. Today I am going to talk about dementia. What are the prevalence in dementia and late diagnosis and ethical issues? First, prevalence. According to the statistics in UK, 850,000 people affected by dementia. It will be expect 2 million in 2050. Next, late diagnosis. It caused so many challenges such as memory problems, cognitive issues, physical and behavioral and communication problems. Not only that, but also we can observe they have difficulty in walking and difficult to have their food, muscles weakens and coordination issues. In their last stage, people face significant memory loss. There are so many ethical issues in dementia. Barrier to seeking help, because individuals seeking help delayed for some reason, cultural, gender and racial factors. So the people couldn't get the quality care from hospitals. And the next one is stigma and discrimination. It's a powerful barrier to lead isolation. They face negativity and discouraged. As a result, it affects their mental health well-being. In UK, lack of specialized in health and social care. So, people only have limited health and social care services. And also shortage home care and day centers. It also caused psychological stress, anxiety, and depression. Additionally, patients and carers faced financial issues. The patients can't get government disability benefits, and local authority also support them. Unfortunately, that is not enough them to lead their family, and it is not enough to contribute their family members also. Another important abuse is their financial information steal from internet, email, over the phone, and credit card also. It caused them distrust loved ones, feel helpless and confused. Many carers gain reduced income. It also caused stress and worried, so they don't want to continue their work. Finally, the prevalence rate is about 1 in 14 people over 65 in UK have dementia. The government and NHS must take actions to reduce this disease. Thank you for listening. My friend will continue.
Hi everyone, I'm Ingrid. I will talk about pressure on dementia service and why this is a serious problem in the UK. First, I want to talk about staff. Right now, there are 131,000 empty jobs in adult social care service. What this means? This means there are not enough workers. The vacancy rate is 8.3%, and many workers leave their jobs. Around 28% of staff leave each year. Why this happen? This happen because the work is stressful, the pay is slow, and the staff feel tired and burned out. Another problem is the training. Not all staff receive proper dementia training. Because of this, some workers don't feel confident caring people with dementia. And these affect the quality of care. There are also problems in the systems. Money for dementia service is divided between different organizations. The service don't work well together. More people wait long time for help, like 17 and 18 weeks to get dementia diagnosis. This shows that is the big problem, because dementia gets worse over time. Finally, dementia diagnosis receive 1.4% of health budget. This shows that dementia don't receive enough priority. Okay, now I will talk about numbers. By 2024, around 982,000 people have dementia in the UK. By in 2040, this number will increase to 1.4 million people. This shows that the problem growing very fast. But now I talk about dementia cost. Dementia cost in the UK is 42.5 billion every year. Around 50% is covered by unpaid care from families. Social care cover 40% and NHS only 10%. This shows that families carry most of the responsibility. If nothing changes in cause of dementia, this number will increase 90 billion by 2040. To finish, dementia service in the UK don't receive enough staff and money. The systems need better funding, more training, better planning for the future. The family is doing too much unpaid care. Thank you for listening.
Hi, I'm Vayami Somratna. Currently, I'm studying Health and Social Care Foundation Level 3, and this is my presentation on dementia. What dementia really means for people and their families. Dementia has many forms of symptoms, but overall, it has a major effect on a person's memory and gradually get worse over time. It affects memory, thinking, and behavior. For some with dementia, this can be very upsetting. Many people feel confused, frustrated, or worried. They can also lose confidence as they become less able to do things for themselves. Families are deeply affected as well. Seeing a loved one change can feel like a long, ongoing loss. Many family members end up caring for their relatives, often without much warning. This can bring stress and leave them feeling emotionally drained. There are also physical and financial pressures. Caring can be hard work, especially as a illness gets worse and the person needs more help with daily life. The financial impact on family means that they will have to reduce and adjust their spending because paying for professional care can be expensive and each situation can be different. The whole family may start to feel the pressure. Dementia can have real effect on health and social care services. One important issue is getting an early diagnosis. If dementia is picked up sooner, people can get help earlier and they can still make choice about their care while they are able. It is important to plan care properly. Care should be centered around person fitting their needs, background and wishes. Because dementia worsens over time, planning help preserves person's dignity. Dementia care work best when different professionals work together as a team. This is usually includes GPs, nurses, social workers, and therapists. Family members looking after someone with dementia will be need the support to cope with changes and to recognize when they need to ask for professional care support because they provide most of the care. and provide help, they can quickly feel overwhelmed and exhausted. It brings big emotional, physical, social, and financial challenges for individuals and their families as well. As more people get older, it becomes more invisible and more will live with dementia, so it is a growing health issue. Noticing early and getting professional diagnosis help people get support sooner and plan for the future. But diagnosis is not enough. People need good person centered care, professionals working well together. Family members or professional carers are the main support for people with dementia, and it has an impact on their daily lives too, and much it's lead to stress and anxiety. It is very important to provide them with proper support and ensure they can cope well. Taking good care of someone affected by dementia requires kindness, compassion, and teamwork. Doing it well means that people with dementia can live with dignity and respect throughout their lives.
My name is Felicitat Vaz, and today I will be discussing person centered care in dementia. When we talk about dementia care today, one of the most important approach is person centered care. This concept was strongly developed by Tom Kitwood, who emphasized the patient should not be defined only by the condition but by their identity, experiencing, and dignity. Person centered care focuses on understanding the individual behind the diagnosis, their preference, history, personality, and emotional needs. For example, instead of forcing a routine, caregiver adapt activities based on what the patient enjoy or feel comfortable with. This approach helps reduce anxiety, improves quality of life, and build a sense of trust and familiarity, which is extremely important for people living with dementia. Role of multidisciplinary team. Dementia care is not managed by just one professional. It's require a multidisciplinary team working together. This team typically includes doctor and neurologist for diagnosis and medical treatment, nurses for day-to-day care, physiologist for cognitive and emotional support, occupational therapists to help maintain daily functioning, and social worker to support both parents and families, and social workers to support both patients and families. Each professional brings a different expertise, but they all work towards one goal: improving the patient overall well-being. For example, while a doctor may prescribe medication, an occupational therapist may help the patient remain independent in daily activities. They collaborative approach ensure that care is holistic, addressing not just medical needs but also emotional and social aspects. Importance of early intervention. Early intervention play a crucial role in dementia care. Detecting symptoms early allow for better management of the condition, slowing down progressing in some cases, and helping patients plan their future while they are still able to make decisions. It also allows family to prepare emotionally and practically, which reduce stress in the long run. Early support system can significantly improve both patient and caregiver quality of life. Conclusions and references. In conclusion, dementia care is most effective when it is personalized, collaborative, and initiated early. Person centered care ensures dignity and comfort, while the multidisciplinary team provides comprehensive support across all aspects of life. Together, these approaches help improve outcomes and overall quality of life for individuals living with dementia. This information is supported by